All right, that was President Biden speaking on the government's efforts to vaccinate the country after the U.S. fell short of his 4th of July goal to get 70% of adults at least partially vaccinated. White House correspondent Karen Travers and ABC News medical contributor Dr. John Brownstein join us now for more on this. Karen, what's the general sense in Washington on why the U.S. fell short of this goal?
You know, Diane, our polls and other networks' polls have shown that there is just a group of Americans right now who are saying they have not gotten the vaccine and don't plan to do so. I actually asked the White House press secretary, Jen Psaki, about that just about an hour ago, of whether or not the administration even knows the number of Americans right now that are persuadable and how you're targeting those people that you think you might be able to convince to get the shot. And Jen Psaki and the president there, their message is that this is really about people hearing it from neighbors, people hearing it from friends and family, and then deciding to go and get vaccinated. You know, 3 out of 10 Americans saying right now they don't think they're going to get it, according to our poll. The White House says that's actually better than it was when they first took office. So they're taking that as an encouraging sign. But Diane, I think it was notable that we did not hear from the president a new timeline or new date about his next vaccination goal. We've been hearing for weeks about July 4th, 70% of Americans, they wanted to see at least partly vaccinated by July 4th holiday. That, of course, did not happen. So now we're hearing from the administration that this is hard work that's going to take place over the summer months. 2 more months now for the rest of the summer. But it was notable that the president is not saying Labor Day. He wants to see 75% or 80% because they know that this final group of Americans, to get that number from 67.1%, where it is right now, to get it to tick up even just a little bit is going to take a lot of hard work and a lot of persuasion.
No timetable, but the president there still striking that optimistic tone as he gave that laundry list of statistics there. Dr. Brownstein, experts have touted these vaccines for months, so has the president, who was essentially just now pleading with Americans to get the vaccine. Those experts have been talking about how safe and effective the vaccines are and how thoroughly that they've been tested. How do you convince someone to get the vaccine at this point if they haven't gotten it already, especially considering that Dr. Fauci just said on Sunday that 99% of the people who died from COVID-19 in June were not vaccinated? What can you say at this point to get someone vaccinated?
Yeah, I think it's a really good point. You have so many people that are sort of hesitant to get the vaccine, despite what we're seeing with the Delta variant increasing, what we're seeing with mortality among those that are unvaccinated. Now it's just about the ground game and explaining to people that are potentially on the fence why these vaccines are important. Yes, to you and me, it seems like, of course, it's a no-brainer, but there are plenty of people that are still concerned about the safety, the authorization, the side effects, but it's also about access. And we heard the president talk about this issue of access. It's a ground game to get people the vaccines. And if people won't go to the vaccines, then you get vaccines to the people. And if it make it that easy for people because it's available through their primary care physician or through door-to-door activities, mobile clinics, then maybe you get someone over the hump. Maybe they're on the fence, but the vaccine's right in front of them. At that point, they would potentially get the shot, especially in light of cases going up in their community.
And Dr. Brownstein, when you working at a children's hospital, I'm sure you talk to a lot of people who are hesitant to get the vaccine for themselves or hesitant to get it for their kids. So do these efforts now announced by the president to get more vaccines into local pharmacies so you can talk to your local pharmacist or get it into your doctor's office or get it into doctors that serve young people so they can talk to their doctors about it, do you think that'll help?
I think this really will help. I know that there was such an emphasis weeks ago about lotteries or free beer or free baseball tickets, but it's really about access and really having the conversations with people around the vaccine. I know it's especially important. We know 20 million people live in vaccine deserts, so no incentive is really going to matter. So the new effort to get it more widely distributed is important, but to get, say, your pediatrician access to the vaccine so they can have that conversation with the child and their parent about why this vaccine is so important. Yes, kids don't experience the same, serious impacts of COVID, but there are still a lot of kids that get severely ill, and this is our way out of the pandemic. So once you can have those one-on-one conversations, once you can have access to those vaccines in those settings, I do actually think that you're going to have a real impact on getting that vaccine rollout further than what we've seen the last few weeks, which is a real slowdown.
And Karen, let's talk about the politics of all of this. There are serious partisan divisions at play when it comes to vaccine hesitancy. 93% of Democrats say they either have been vaccinated or definitely or probably will do so, but less than half of Republicans say the same. How can President Biden bridge that partisan divide?
You know, Kenneth, the White House officials will say he probably can't, that there's no message that the president can deliver, even if he were giving speeches every single day for the next several months, that might convince some of those people who right now have not gotten it. That's why they're really trying to emphasize this at the local level, that some of those Republicans might hear from their Republican friends who got the vaccine, and that might push them over and decide that they will get it. I think it's notable we see the president coming out here today. We'll see the First Lady traveling this week, and there was a lot of travel in the month of June. It was a month of action for senior officials at the White House, and those numbers were still kind of slowing down to a crawl. They really do believe that this is something where it's peer-to-peer, family members talking to family members, or neighbor to neighbor, that will make more of a difference than all of the talking in the world coming from Washington.
And we will see how the action plan materializes in the months ahead. From the White House, Karen Travers and Dr. John Brownstein, thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.